According to the Ministry of Health, the Social Health Authority will be digitized to prevent fraud while ensuring equity in the provision of healthcare through collective contributions. And as Elizabeth Otieno now reports, the public participation exercise has officially begun to gather views from Kenyans so as to make some proposed amendments in the new health law.
Today marks exactly 7 days since the Court of Appeal lifted High Court orders barring the implementation of the Social Health Insurance Act of 2023. The transition from NHIF to the Social Health Authority has been intensified as Kenyans raise concerns on the safety of their previous contributions channeled to NHIF. The Ministry of Health has now assured Kenyans that no amount of money will be lost during the transition. Important to note that some health facilities in the country owe NHIF claims amounting to 29 billion Kenya shillings.
No member who has already paid the NHIF should be asked to pay afresh. Upon registration, I know there are people who pay annually. Then it is for the Transitional Committee and Social Health Authority to say how is it that they convert that payment into share without asking the member to pay again. There are service providers that NHIF owes money. Those are some of the liabilities then that moves to Social Health Authority.
Kenyans are required to register for the Social Health Insurance Fund SHIF within 90 days upon the implementation of the regulations. Additionally, there will be a 2% penalty for those who default on the contributions, which is annual for those on informal sector and monthly for those employed.
First of all, there was an issue of out-of-pocket expenditure. Insurance penetration in our country is extremely low. Most people are paying for healthcare out of pocket. You've got limited access to healthcare services.
If Kenyans think that there should be a cap, they should tell us and tell us how much to cap at. Is this an issue of the rich paying for the poor? Not exactly. If you look at the current NHIF model, it is the people who are earning less that pay more.
Newborns will be registered 14 days after birth. Biometrics will then be taken once a child attains the age of 7.
And then the authority shall, upon the examination of that application, register the applicant as a member of the fund, the Social Health Insurance Fund, and assign to each beneficiary that had been listed under the application form a social health insurance number.
Those traveling into Kenya shall possess a travel health insurance cover, which shall cover the person's entire stay in Kenya. This will cater for the traveler's health services while in the country in facilities registered at the Social Health Authority.
So the SHA card will not discriminate. You can access services in facilities so long as they have been empaneled by SHA.
Recently, Kenya has been struggling with a shortage of cancer drugs and the Ventolin inhalers for those with asthma. While acknowledging the crisis, CS Nakumicha said the Facility Improvement Fund will help solve the problem witnessed in the supply chain system.
That FIF enables facilities to have their own boards that then determines where the revenues that they generate will go to.
Public participation exercise has officially kicked off. The process is estimated to be concluded before March. The report on the same will be presented for approval from both the National Assembly and the SIGNET Health Committee before gazettement and finally implementation. Elizabeth Otieno, TV 47.